I see some beautiful orthodontic work that is done. You have a lingual wire holding everything, but then posteriors are completely lingually inclined and the posterior is collapsing. It was soon after that I learned muscles dominate and airway basically dominates. These patients were trying to open up their airway. I expanded my knowledge into more looking at the function. What are these patients doing and why they're doing this? And that's when I realized, okay, 86% of population suffers from malocclusion in modern societies, and about 30% of these people are symptomatic with TMD, jaw joint popping and clicking. We know form follows function, and function follows airway. Air always wins. We were trained as tooth mechanics and not the doctors of the oral cavity. We learned to look inside the mouth, not sit back, and look at the face, look at the body, look at the connection of the orthopedic alignment of the head and neck, and ignoring it will just end up with failures. If you like to see failures in your practice, it's not fulfilling. When you offer more of a comprehensive approach, it's very fulfilling. I think there's been a disconnect between orthodontics and orthopedics of the head and neck. A completely edentulous patient is usually not a TMD patient. Why? Because they have no teeth. And as dentists, we need to realize that there's many people suffering, and that comes from our lack of knowledge. It just takes a little bit of understanding. Just look at the anatomy, look at the development of the jaw, look at the airway. Within 2 hours, you can learn it and start implementing it in your practice. One technique that I've been using it for 25 years is ultra low frequency electrical neural stimulation. We're actually stimulating facial and trigeminal nerve. And the facial and trigeminal nerve, they have the motor nerves and sympathetic and parasympathetic. So what happens is that it calms down the muscles by tensing, and then it allows that mandible to land to its ideal position. It just breaks my heart to see so many patients suffer for so long when there's a simple solution. It is a complex problem, but once you see it, you cannot unsee it, and it becomes such a simple solution.